Hi everyone, Dr. David Kulla here with Synergy Wellness in New York City. So today we have a case that I've never done a video on, cubital tunnel syndrome. So Daniela here has cubital tunnel syndrome as well as carpal tunnel syndrome. So I'm going to show you how we treat that. And for those of you that don't know the difference, carpal tunnel syndrome is an entrapment of the median nerve, whereas cubital tunnel syndrome is more on the outside of the wrist, entrapment of the ulnar nerve. And the cubital tunnel syndrome will typically cause numbness in the pinky finger and half of the ring finger, the fourth digit. Okay, yes, just half of it. Now, a lot of times cubital tunnel syndrome is missed because sometimes the median nerve entrapment or carpal tunnel syndrome can cause numbness across the whole palm for some people. So I've actually seen it just across the whole palm and they can't really differentiate whether it's the pinky finger or half of the ring finger. So we're going to laser her. Hands down, laser, cold laser is the #1 treatment for carpal tunnel syndrome. And guess what? It is for cubital tunnel syndrome as well. Carpal tunnel syndrome is the only condition where cold laser is FDA approved. It's stupid because laser does so much more for so many other conditions besides carpal tunnel, but it does respond. Carpal tunnel syndrome responds very quickly. She came in here to see me for something else, a hiatal hernia, but I've been kind of pushing her to let me treat this and help her with this because I know that I can help her with it. So we've been adjusting her wrists, we've been adjusting her elbows, check the shoulders, and that's always something you want to do and make sure the alignment is correct. So I'm going to show you how we adjust her shoulders and take a look at that. There's a series of muscle tests that we do for her to do that. So this light is really bright. We're gonna shut this down a little. So what I'm gonna do is I'm gonna go ahead and test her elbow here, and we're gonna test both joints, the radial and the ulnar. So we're gonna push down here and 1, 2, 3, resist. Good. And 1, 2, 3, resist. Good. How does that feel?
Better.
That is strong. So last week, she couldn't even hold it. When I pushed in, it would just collapse and it was painful, right?
Yeah.
This one was worse though, wasn't it?
Yeah,
This side's worse.
this side's
So
worse.
let's see, we just tested the better side, so I'm not gonna toot my own horn here, but this is the radial head test and resist. Good. Was that painful?
A little, yeah.
And 1, 2, 3, resist. Good. Okay, and was that painful?
Yeah.
That last one was?
The last one was.
Okay.
Yeah,
It wasn't.
Mhm.
It was not
It was
painful?
not.
Okay, good. So the elbow joint is good. It's testing normal. There's nothing to adjust there. Relax here. There's nothing to adjust there. So we're not going to adjust anymore, but she's still having pain, numbness, tingling, and she works with her hands all day. What do you do for a living?
Scribe.
She's a scribe. Can you imagine? I don't know, like imagine if you worked at Amazon packing stuff, lifting stuff out of the warehouse on shelves and you had back pain or shoulder pain. You'd be miserable at the end of the day. We need to get her out of that misery. We need to get her to do her job without any pain, without even thinking about it, and going home at the end of the day without being sore. So that's what we're doing. So now, at this point, she's improved significantly with the strength of the joint and the alignment of the elbow joints. But now at this point, there's still some impingement there. And that could be for a number of reasons. So we're gonna go ahead and treat her cubital tunnel syndrome and her carpal tunnel syndrome today. And it's really simple. We spend about 5 minutes treating the wrist, each wrist. We're gonna do each wrist, we're gonna do the cubital tunnel, and we're gonna treat here in the cubital area, and then also up here at the elbow level. Okay, so we're gonna laser her in a few spots, but we'll certainly do a follow-up video with her after a handful of laser treatments. But hands down, if you have cubital tunnel syndrome or carpal tunnel syndrome and you're considering surgery, stop. Consider doing cold laser therapy. And if you're gonna do it, make sure you do at least 6 to 10 sessions. And I will tell you this, if you have carpal tunnel syndrome and you're pregnant, the laser will not help. Do not do cold laser therapy while you are pregnant. The carpal tunnel syndrome may be a result of the pregnancy. So as soon as you have the baby, the carpal tunnel syndrome will go away and get better in that case, okay? So you don't want to laser somebody that's pregnant. So again, if you have cubital tunnel syndrome, entrapment of the ulnar nerve, or carpal tunnel syndrome, entrapment of the median nerve, cold laser therapy can reduce inflammation in the cubital and the carpal tunnel. Not only reduce inflammation, reduce swelling, okay, reduce pain, and inhibit nerve impingement, okay? And it's a game changer, and it will correct this for good, and you won't need to go get surgery. You can avoid surgery by doing cold laser therapy. Hope that helps. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like, and don't forget to subscribe. Appreciate you guys.